They found no convincing evidence that people with depression had lower serotonin levels. We can safely say that the serotonin theory of depression is not supported by scientific evidence.
The information shared on the Rethink It podcast is intended for educational and informational purposes only and should not be taken as medical advice. While Dr. Sande is a licensed medical provider, the content of this podcast is not a substitute for professional medical diagnosis, treatment, or advice specific to your individual health needs. Always consult with your healthcare provider before making any decisions related to your health or medical care.
Welcome back to the Rethink It podcast. I am so glad you guys are back here with us today. Today is a special episode. I am very excited. Everyone is a special episode. You know that by now because I say that every time, but it is a special episode. I am trying to bring you guys some content that is consumable in less than an hour. And so this is the launching episode that will give you some of that content in consumable format. So you don't have to pause and replay and then lose us. So this season, we're launching just a season where we're rethinking the brain naturally. We've done a little bit of that in the past, but we're really going to focus that this season. And today's episode is going to be tackling the serotonin myth. You heard that right. The serotonin myth. So have you ever felt frustrated that your antidepressant is not seeming to work, or worse, that you feel numb or disconnected? You are definitely not alone. For years, we have been told that depression is caused by a chemical imbalance, usually a lack of serotonin. And for just about as long, we have been prescribed medications that claim to correct that imbalance. But new science and old wisdom is telling us a different story. And today we are going to unpack that reality. We're going to be gentle about it. We're not telling anybody to get off their antidepressants here. This is definitely not what we want you to do. Just abruptly, cold turkey, take this information and make radical changes. I want you to be connected, empowered, restored. Okay, so today we're unpacking this information with gentleness, with honesty, with compassion, and above all, as you guys know, I want to bring you hope. So hope for lasting healing. So we will be doing this episode rooted in the hope that we trust in our bodies and that what our bodies are truly capable of when we remove all these barriers we put in our way of healing. The chemical imbalance theory. It's not just outdated, it has actually never been proven. The idea started in the 1960s, like all good scientific theories. They start with a hypothesis, not really a medical fact. It started with a hypothesis that should be in normal medical circumstances and scientific practice. We would take a hypothesis and then test that hypothesis and prove that hypothesis. But though this was a hypothesis that started in the 60s, we actually have never come across the proof. Okay, SSRIs like Prozac were developed before we even had the tools to even test serotonin levels. It was catchy, it was marketable, and we bought it. So in 2022, there was an interesting study that came about led by a psychiatrist named Dr. Joanna Moncrieff, and she examined decades of studies, and you will not believe what she found. They found no convincing evidence that people with depression had lower serotonin levels. We can safely say that the serotonin theory of depression is not supported by scientific evidence. So what's really going on? That's the question. Depression is not a flaw in your chemistry. It's a signal. Sometimes it's from the gut, sometimes it's from the immune system, and sometimes it's from a stealth infection. And you guys have been listening to this podcast long enough, you know I cover all of that, and we're going to go into more detail in the coming weeks. Chronic inflammation would be one form of trigger that could trigger depression. As a mother of several children with ADHD who have been prescribed medications like this. I have children with depression. I have a child with pandas. I can tell you when the treatment involves increasing inflammation in the brain, there is a depressive side effect. And I can personally tell you I've lived that experience as well. So chronic inflammation is a definite trigger for depression. Inflammation from mold, from toxins, from trauma, these create something called cytokines. And those cytokines can affect the brain mood centers. These cytokines can reroute things like tryptophan. If you don't know, tryptophan is our substrate from which we make serotonin. It is tryptophan, 5-HTP, then serotonin. That's how it's broken down. That's how we make it. And so when the cytokines reroute tryptophan away from our serotonin production, that leads us into the production of neurotoxic pathways. So basically, we take our tryptophan away from the production of serotonin and we reroute it to make neurotoxins. It's a real thing. Number two, we can have a gut-brain problem, right? How many times have you heard me talk about the gut-brain connection? And you may know this, and maybe you don't, but 90% of your serotonin is produced in the gut. That's 90%. When the gut is leaky or dysbiotic, meaning you got a total imbalance of the gut bacteria, serotonin signaling and your vagal tone gets impaired. So you have less tone of the nerve that causes rest and digest. Poor gut health equals poor brain resilience. Number 3 would be our mitochondrial dysfunction. How often do you hear me talk about that? Mitochondrial dysfunction is a huge thing. It is hard to measure. There is currently the only tests we do have are things like the oats test that test the metabolic byproducts of mitochondrial production. And mitochondrial dysfunction is really an important thing because your brain, the neurons contain about 2 million mitochondria per neuron. So when we have mitochondrial dysfunction, your energy runs low, your brain energy runs low. Low ATP equals low mood. The mitochondria make your ATP. And then on top of that, if your mitochondria are inefficient and they aren't making energy in the normal process, just like an old engine starts to make more smoke and exhaust at the end and less drive forward and, whatever you call that stuff that moves your car. The same thing can happen to your mitochondria. And then what happens is you end up getting biological toxins being produced by inefficient mitochondria. Those mitochondrial toxins can totally sap your brain's resilience. I mean, it will just knock it right out. On top of that, your toxins that you ingest in your food can damage your mitochondria and the cycle can perpetuate itself. And that all impacts brain function, brain centers, and mood. Stealth infections, these things have been talked about for 20 years. Stealth infections is a big topic. This is the chronic Lyme. And people always ask me well, were we always having Lyme? What is the deal? Is this new? Why is there such an increase in Lyme and these bacterium? And that's an interesting question, and we'll go into that in a minute. I'm referencing a book here by Paul Ewald. He actually wrote a book called Plague Times back in the 2000s, early 2000s, and this is where we need to zoom out a little bit more and look at what he says about chronic infections and microbes. Paul Ewald presents a very powerful case that chronic illnesses like depression can actually be triggered by persistent low-grade infections. Microbes like Epstein-Barr, Lyme, Bartonella, Babesia, chlamydia, even chlamydia pneumonia. You'd think that's just that sounds like it's going to cause pneumonia, and it does, but it can also be persistent and cause brain problems. They can live in the tissues for years. They don't always make you acutely sick, but they can subtly hijack your immune system and disrupt neurotransmitter production and cause inflammation in the brain. What if your depression isn't a serotonin shortage, but from being caused from your immune system battling a chronic infection that you never knew was there. That's a thing to think about. So when we start looking at things like in this kind of context, there's a lot of things that can literally contribute to your brain health being disrupted and dysfunctional. And Paul Ewald goes on to talk about in his book that things that cause you to be acutely sick, you get over quickly, and they actually decline in virulence. And this is kind of a classic thing where it's demonstrated really well with the flu. Okay, with the flu, each year there's a new strain. The old strain has become less virulent, and so you get acutely sick from it. The next year, you're not going to get that same strain of flu. It's less virulent. But those things that can hijack your immune system, these like subtle immune bugs like Epstein-Barr and Lyme, they actually increase in virulence over time. And this is one of the hypotheses of why we think that these bugs are persisting and becoming worse over time, is because, according to the work from other, Paul Ewald, he's an evolutionary biologist. He and other scientists believe that there is an increase in virulence over time in these stealth infections because they are not causing an immediate response. They're tipping the immune balance between the acute illnesses and the chronic illnesses, and sabotaging the T cells so that they can't actually react and manage the infections as well. And then that ultimately leads to an imbalance where the body can't even respond to normal acute things, and you get sick all the time. But what does that have to do with the brain? Well, if it's sabotaging your immune system, we have something called the neuroendocrine immune system. They're not all pathways that all operate on their own. They interplay with one another. And that's the theory behind why it causes brain problems. Hey guys, I wanted to pop in, interrupt our podcast to encourage you guys and let you guys know, if you didn't know, our book is available. Stephen's story about his struggle through Lyme disease. Our book, Kids Get Lyme Disease Too, One Boy's Journey of Trusting God Through Lyme Disease. It is available on all areas that you can get books, everything from Amazon to Barnes & Noble to everywhere in between. All the places that you pick up books, you can pick up our book. So please support us and get the word out. If you have a child that's struggling, it doesn't have to be Lyme. I know so many children who just feel weird because their health doesn't match that of their peers, and they feel isolated, they feel unseen, frustrated, and alone. This book is meant to encourage those children. It's meant to encourage you parents that you can get through it. It's meant to make you feel seen and heard and give you hope. So please pick up our book. Thank you so much for supporting our podcast and all the things that we do. You can see it's an ever emerging thing. I'm changing my studio. Today I'm wearing scrubs because this is the only time I've had to record, and I'm doing the best we can. And I appreciate that you guys are here with me at the root level, at the ground floor, as I'm trying to get information out to you guys that is valuable and hopefully life-changing, starting with the book. So pick up the book wherever you can pick up books, and thank you in advance for all your support. So what do we do about this situation? What are things we can actually do to help our mood if we're trending toward, depression? I mean, it happens, and it's horrible, right? So, of course, take inventory. If you can think clearly when you're struggling, take inventory of the things I just mentioned. I mean, are we dealing with, is your gut healthy? Have you been eating crap? Have you been eating out? Did you eat In-N-Out burgers or McDonald's, or just even what seems like relatively nice restaurant food? And then you felt depression, because that can be a thing. I see that in my oldest. Have you been sick? Do your joints hurt? Are you dealing with kind of chronic? You just deal with pain all the time. You're just sore all the time. Muscles hurt, neck hurts. Everything just hurts all the time. Chronic inflammation. Are you chronically fatigued? You literally, in mitochondrial cell danger response, the mitochondria are rocking at the bottom of their energy production. Take inventory. Have you been exposed to a lot of pesticides knocking out your mitochondria? And lastly, is there a possibility that you might be dealing with some kind of stealth infection? So take inventory. But the next thing I would do is really start boosting some things that in your diet. I would be focusing heavily on your omega-3s. Go for those omega-3s, good, clean, quality, high quality omega-3s. Take a shot of olive oil in the morning. Definitely go with the polyphenol-rich foods. We're looking at what we call a Mediterranean diet. Mediterranean, paleo, my favorite diet combination. Eliminate foods that are often triggers for neurologic things, for a leaky gut, which causes gut-brain dysfunction, which leads to the depression. So think about the foods you're eating. Are you eating gluten? How about the added sugars? Are you drinking an energy drink every day? Where are some hidden sugars? And by the way, don't forget about the hidden aspartame. And the xylitol. Xylitol tends to be a pretty and positively inflammatory sugar substitute. How about sleep? Are you sleeping? Take inventory of that and let's work on your sleep. Get to bed early. When you're depressed, it's easy to sleep all the time, but try to set yourself up for a balanced circadian rhythm. There is power in sunlight. So get up at the sunrise, go to bed, at the same time every night so that you can get yourself 7 hours of sleep. It's non-negotiable when you're trying to deal with your depression. The hardest part is the getting out of the bed, right? Get out of the bed, get the sunlight. How about nervous system? Well, how can we heal our nervous system? This is where the breath work comes in. This is where prayer is important. This is where vagal nerve stimulation helps. How do we do that? My favorite tool that is versatile and useful, honestly, is essential oils. If they're good quality essential oils, those things are versatile. You can use them for so many things, and certainly you can stimulate the vagus nerve. Now, if they're crap and you got them at Walmart in the arts and crafts section, they're going to stimulate your flight or flight. They're not going to stimulate that vagus nerve. So try to avoid those. But do some good quality essential oil. Breathe them in, put them on, use them. Trauma is stored in the body, but the good news is so is healing. Healing lives there too. So, we have to work on addressing the trauma that might be present. You need to dig deep into your emotional life and process those things properly. Don't do like me and say, I'm fine until you crash and burn. Okay. You're not always fine, and it's okay to be not fine. Process that, meet with a friend, find your community, and work through those things. You are loved, and you probably don't even realize how loved you are. So reach through and deal with that stored trauma. Do your breath work, do your prayer, do your vagus nerve stimulation, and reach out for a friend. How do we support the mitochondria? Remember we talked about the mitochondria being crashing and burning, causing major problems to our brain. 2 million mitochondria per neuron. Well, the key nutrients to support that are things like magnesium. Magnesium threonate is the best one for your brain. I love that supplement as a brain support supplement. You cannot go without your B vitamins, B6, B12, and folate. You gotta give the mitochondria CoQ10. Why do statin drugs cause such a problem? Because they rapidly and drastically reduce your CoQ10, and that's why we see cognition changes. CoQ10 drops to something like 10% within a month of taking a statin drug. So, do I love statins? Not so much. CoQ10, that's a great one for your brain. You can think of things like PQQ and zinc. These things really support the function of your cells, and that's where it's at, people. And then lastly, some herbals that really are a powerful support for mood, and some might surprise you. Some might be like, yeah, I knew that. How about ashwagandha? Did you know ashwagandha is a ginger? It's a ginger. But ashwagandha is one of those products that certainly if you are in the Ayurvedic tradition and you have a dosha, that pitta dosha, you do really well with ashwagandha, the one that kind of has the balanced constitution, you're going to do really great with ashwagandha. And you're also going to do really great with ashwagandha if you're a kapha. Rhodiola, that is another amazing adaptogen that helps you get through stress that's triggering your mood changes. And lastly, saffron. Let's talk about saffron for a second, because there have been clinical trials on saffron. Saffron has been shown to be as effective as SSRIs for mild to moderate depression, and it has fewer side effects. Did you know that Prozac and most serotonin reuptake inhibitor, selective serotonin reuptake inhibitors, your SSRIs like Prozac, they actually contain fluoride as a molecule to drive the active ingredient into the cell. What do we know about fluoride? It's a neurotoxin. So while those medications may create some degree of benefit to your mood for a short term, the impact in the long term can be catastrophic. And when it comes to fixing the gut, there are actually some bacteria, some strains in your probiotic. If you're looking to heal the gut, you know what we do for the gut. We support the gut lining. We give you a probiotic. We work on some enzymes to break down food and take the pressure off your pancreas and other areas, and really break down your food and get the nutrients out of your food. But probiotics have a powerful role to play in mood. And there are certain strains that actually have been identified that have been very, very beneficial to mood. And I'm just going to list a few of them for you here. We got Lactobacillus helveticus, Lactobacillus rhamnosus, Lactobacillus plantarum, and Lactobacillus casei. Okay, those strains of Lactobacillus are specifically really great. The helveticus actually has been shown to reduce anxiety and depression symptoms. And actually, that one and Bifidobacterium longum, both of them have been shown to reduce anxiety in studies. The rhamnosus supports GABA. GABA is your calm down neurotransmitter. Okay, this bacteria actually supports GABA receptor expression, so that when you get the GABA from your food and your body breaks it down and you make some GABA, you can actually get it into the doors to the brain to stimulate the calming response, to work against glutamate, your excitatory neurotransmitter. It calms the nervous system. The Lactobacillus plantarum modulates dopamine and serotonin in neurologic conditions. So it's a very, really, really good bacteria if you're dealing with COMT mutations and dopamine issues alongside serotonin, because remember, we don't just have SSRIs, we also have NRIs. So we have drugs that support non-serotonin transmitters for depression as well. So dopamine plays a role in your mood. Bifidobacterium brevi, I didn't talk about that, but it actually improves BDNF, which is your brain-derived neurotrophic factor, which helps you keep your brain volume intact as you age, and it helps you make new brain cells. So BDNF, as we know, the most beneficial way to improve your BDNF is to exercise, to walk and move your body. So BDNF is a powerhouse, but there are many foods and herbal supplements that really do a good job of supporting your BDNF alongside exercise. And Bifidobacterium brevi, which is one of those probiotic strains, really does improve that, and as well as reducing your neuroinflammation, that low-grade inflammation that's causing some of that depression modulation. Lactobacillus casei helped in certain studies has been shown to boost the mood from a baseline mood. So just look for these if you're looking for a probiotic to help specifically with depression. They actually have this category of strains of bacteria actually have a name, and they're called psychobiotics, and they show us just how powerful the gut-brain connection really is. When you're choosing a probiotic, look for those specific strains, aim for 10 to 20 billion CFU minimum, and choose formulas that have been third-party tested with prebiotics like inulin or other prebiotics. These are really important things to drive the effectiveness of these probiotics. So what we're seeing in the research is that there just simply isn't any. And just to finish strong on sort of the studies on this, so that you don't just have to take my word for it and think I'm making this stuff up, here are a couple of quotes from leading scientists in the area. Of course, we talked about Dr. Moncrieff. She said, her quote is, "There's no convincing evidence that depression is associated with or caused by low serotonin concentration or activity." There have been multiple critiques among her colleagues as well on this. The other thing that's really interesting is when we investigate like peripheral markers like serotonin in the plasma and their metabolites, the results are inconsistent, often failing to replicate the problem. So they don't reflect low. So if we're saying that low serotonin is the cause of depression, these studies are actually finding that there are sometimes in depressed patients elevated levels of serotonin, not low ones. So that is an inconsistency in the research. There have been no PET scans, no CSF studies where we look at the cerebral spinal fluids that reliably show lower consistent serotonin levels across all individuals with depression. Sometimes they're high, sometimes they're low. So there's just conflicting evidence to support that. There was another study on receptor dysfunction, and this one was from 2016. Basically, they said, they found that PET scans there were 218 PET scans done. There were 261 controls, so this was not massive, but it was still big enough. And they found relatively moderately reduced serotonin receptor binding in people with depression, especially in certain areas of the brain. They did also show that they had smaller hippocampuses, which is the area of memory that is associated with depression as well, and other areas of the brain. There was no effect found on the amygdala, which is usually our emotional center. In 2024, there was another analysis that showed some decreased serotonin receptor density in the mesiotemporal cortex. I know this is nerd sounding, but I'm just trying to drive the point home that basically receptor abnormalities may be present but are inconsistent. Instead of showing that the low serotonin levels are the problem, it actually suggests that there may be a dysregulation between receptor expression. So the doors that the serotonin has to enter to get into the nervous system, those things are disrupted sometimes and dysregulated. Not necessarily always low, but some areas of the brain showed lower receptor density. That is not overcome by giving you more serotonin. In fact, more serotonin leads to less receptors. The response of the body is to take away receptors if it thinks it has plenty of the serotonin, because there's no problem getting all that serotonin through the door because there's lots of serotonin. If there aren't a lot of serotonin, then the body has this beautiful way of opening more doors to get in whatever a serotonin there is. So, or neurotransmitter or dopamine or whatever transmitter that might be, which is the real reason behind like chronic pain as well. So, but I digress. So the point is that when we looked at PET scans, they showed some, abnormal dysfunction in the receptors. In fact, some studies paradoxically showed increased receptor binding sites in patients that were depressed. So that's crazy, right? So the serotonin syndrome, these are the studies. I'm finishing and driving it home, and I really want you to understand that you are not broken. You are not broken. You may be inflamed. You may be burdened, but you are not broken. Okay? Serotonin is a simple way to explain away your symptoms, and you are not a simple thing. You are complex. Things like genetics can impact this. Your methylation, regulation, COMT, and other genetic variants lead to weird receptor dynamics as well. So it's not you that's broken. The problem is bigger and you are more complicated. And that complexity is beautiful, and it should deserve your attention and your love. Love yourself and taking the time to investigate the problem rather than bandage it and give up. You're worth it. Your symptoms are not a sign of failure. They're actually a call to investigate deeper. And when we do, we'll find a great path to healing. And it rarely begins in a prescription bottle. It begins with understanding, nourishment, and hope. And I hope that really gives you, leaves you feeling empowered, not broken. I don't want you leaving discouraged. I want you to remember that you are not crazy. It is your brain. It is your health. It's your move.